Hello, welcome to Quality Insights. Our goal is to help you implement systems and processes so that you can get more things done in less time and comply with the regulations. My name is Sanjay Dal. I am the group leader for the quality and compliance solutions at Quality. I have 20 plus years of experience in the quality management systems and the applications in medical device and life science industries. Today, we're going to discuss top 10 factors that you should consider when you are going to select a QMS software for the medical device and life science applications. Let's get started. Are you using paper-based or Excel spreadsheets to manage your QMS functions? It may be working, but it will be taking a lot of your valuable times. And when someone forgets to keep the records or misplace the records, then you may run into compliance issues. What you need is a well-organized electronics quality management systems so that you can keep the records and you can see if things are going well or things are not going well. You can monitor the performance of the systems as well. But the challenge is that there is no one size that fits all. So you have to find one, you have to select one that meets your needs and requirements. So as I mentioned, if you're using a manual QMS systems, it is error prone and you won't have visibility regarding the performance and you may run into audit issues. It may be taking a lot of your valuable times. You can access your quality management system anytime, anywhere that is connected to internet. And also you can get a software that's validated and complies with the FDA and European regulation. Number one in our list is when you are going to select a QMS software, you must make sure that the software has been validated for use in the medical device and pharma applications. So the level of validation requires depends on the workflows, depends on the risk of the processes. You should do a risk analysis or if you are going to get a validation reports from the vendors or from the suppliers, that should have been a risk analysis based on the workflows, based on the use case scenarios, based on impact to the integrity of the data, and you should have a good validation report for the QMS software itself. There are many mandatory requirements. For example, you should have user requirement specifications, you should have system requirement specification, traceability metrics for the validation of the QMS software. So you can refer to ISO 13485 standards or the FDA guidelines regarding the validation requirements for the softwares. And those validation reports should be available during the compliance audits. Number two item you should consider is 21 CFR Part 11 requirement. So the 21 CFR Part 11 requires that you should have the records that follow the ALCOA rules. ALCOA means A stands for attributable, which means when the record is created, you should be able to trace it. Who was the person who created the records? L stands for legible. Legible record means the electronics records shall be created in a format that's readable and retainable for long periods of time. For example, if you create records in PDF or XML formats, those would meet the requirements. C stands for contemporaneous, which means the records should be created at the time of event. You should not be creating records after the event has happened. Original means the electronic records should be in the original forms. Accurate, again, the records should be accurate based on the facts. And there is another requirement for the 21 CFR Part 11 is the electronic signatures. The electronic signature has to have two parts, ID and password requirements. And the electronic signatures are equivalent to legally binding wet signatures, which are to be unique for one individual. Number three item you should consider is the usability and intuitiveness. If the system is hard to understand, if it's hard to use, you'll have a lot of challenges convincing the users to use the softwares. What's the point of having a software if the users are not going to use it? And you should have the software that's customizable and maintainable. For example, so you're never going to get a software that will meet 100% of your needs. You should have the option to change the labels, change the drop-down list so that it meets more of your needs. Number four item is backup and security. So if you're going to use a cloud-based QMS softwares, then the software vendor should have systems and processes in the place to manage the data, security of the data, backup of the data, and in case something happens, you should have the system to recover, what we call as a disaster recovery systems and processes. In case something happens, you should be able to retrieve the data. Number 5, training and support. It's very important to have good quality support available from the service providers. If you're going to get a cloud-based software, the support staff should be knowledgeable regarding the functionalities of the softwares and the regulatory requirements as well, so that they can guide you in the proper use of the QMS software. Number 6, integration of the functionalities. So in a QMS software, there are multiple modules involved. For example, design controls, risk management, document change control, training, corrective actions, complaint management, supply quality. So if you have the modules integrated, it will be very easy to keep the records and give the references. You should be able to manage the audits very easily and efficiently. Number 7, user management and access controls. When you're going to use the software applications where multiple users are going to be using the softwares, you must have a system that have the access control requirements, so that only people who are authorized, they can approve the records, or someone who has admin access, they can control the permissions of other users. Number 8, design history and risk management. So for the medical device and life science applications, you will be doing design control and risk management. So you'll be creating design input files, design output files, design review records, and creating risk management files. So if you have the design files or the design documents integrated, it'll be very easy to manage the records and also handle the compliance audits. Number 9, document change control and training records. So when you are going to make document changes, you should have an options for creating training records or linking the training records to the change records, so that you can notify the employees, notify the users that the change is coming, the change has been approved, and you can keep records of such notifications have been done. Number 10, complaint management. It's very good to have a complaint management modules in your QMS softwares. You should, in the complaint management module, at least you should have the option for recording the complaints by date, name of the complaint, type of the complaint, whether you made the decision to investigate the complaint or not to investigate the complaint, a decision to recall or not to recall the products, decisions regarding the corrective actions taken. So those informations are very useful when you are handling the compliance audits. Another bonus factor you should consider is the previous history and the testimonials. So if you're going to get the software from a service providers, if the service providers has a good track records of previous rollouts of the QMS softwares for medical device and QMS applications, that gives good evidence that the software has been qualified, validated, and accepted. In summary, it is your responsibility to select a proper QMS software that will meet your needs for the medical device and life science applications. And the software should help you comply with the regulatory requirements. If you would like to learn more about our systems, please visit qualcy.com, and please take a look at the videos, and please take a look at the blog post we have posted. If you would like to learn more about our systems, please send us a message at qualcy.com. Thank you.